This next batch of anti-cancer agents works by inhibiting topoisomerases, the enzymes that relieve the supercoiling produced during the unwinding and separation of DNA by helicase. I don't know about you, but when I think of a supercoil of strands being let loose, I think of that fair maiden Rapunzel trapped in a tower by her evil stepmother. Her only way to contact the outside world? Unwinding those supercoiled strands of hair. Yeah, I know how that goes. Full of teen angst, letting your hair grow out, wearing flannel, and learning all the riffs from Nevermind. Welcome to adolescence in the 90s. And here's Rapunzel now, not waiting for a prince to save her. Fashioning some kind of harness or something out of those golden locks of hair, and making her escape while her stepmother is away. As she exits the top of the tower and belays down the side, think of the anti-cancer drug etoposide. Etoposide is a semi-synthetic derivative of the plant alkaloid podophylotoxin, which targets topoisomerase 2. Remember, the topoisomerases are enzymes that relieve the DNA supercoiling that occurs during DNA replication as a result of the separation and unwinding of that double helix. And fittingly, the braid of hair at the end is unwinding. Not only that, notice that Rapunzel is grasping onto 2 strands of hair as she belays down the side of the tower. 2 strands for topoisomerase 2. While topoisomerase 1 makes single-stranded nicks to relieve negative supercoiling, topoisomerase 2 induces transient breaks in both DNA strands simultaneously to relieve both positive and negative supercoiling. Specifically, etoposide and podophyllin inhibit topoisomerase 2's ability to seal the double-strand breaks that it induces, causing chromosomal breaks to accumulate and eventual cell death. So we've made Rapunzel's strand snap just like a DNA double-strand break. Should have put some conditioner on that thing or something. Although there is a door and a spiral staircase leading down from the tower, Rapunzel's stepmom made sure she'd be trapped up there forever. So, the bottom of the stairs were never completed, as indicated by the stairs out sign. The spiral staircase is meant to evoke an image of a DNA double helix, and the break in its construction should remind you that topoisomerase blocking agents inhibit DNA synthesis, arresting cells in the S phase of the cell cycle. Also, look closely at the sign left by her evil stepmother, who's probably off to gather some more podophyllum extract. Gone to forest, with emphasis on G2. You see, if cells make it past the S phase, they may also be arrested in the G2 phase of the cell cycle. In this phase, DNA is checked for errors and corrections are made. Block that topoisomerase, and this becomes yet another stage when those double strand breaks are left unrepaired, leading to apoptosis. Etoposide has activity against many solid and hematological malignancies, including testicular cancer, small cell lung cancer, as well as Hodgkin's and non-Hodgkin's lymphoma. So, we've incorporated a medieval cancer crab crest onto this banner hanging from the dilapidated tower. It's tattered and torn to represent the use of topoisomerase blocking agents in cancer chemotherapy. The major toxicity associated with etoposide is myelosuppression, as depicted here by Rapunzel's bone-shaped luggage thrown from the tower, cracked open with some red, marrow-evoking articles of clothing spilling forth. A decrease in the number of white blood cells means that patients on etoposide therapy are at higher risk for infections. And if you look closely in the shadow behind the tower, we've included our recurring immunocompromised cane, held by Rapunzel's evil stepmom returning from the forest a little earlier than expected. Another side effect of the topoisomerase inhibiting agents is alopecia. And as you can imagine, brushing those long golden locks comes with its fair share of hair loss, as evidenced by these strands of hair strewn at the bottom of the tower. And before the evil stepmother can step in to thwart her getaway, in rides the prince to rescue Rapunzel. A little late to the party as usual. He sends off his trusty toucan with the message, "Rapunzel, Rapunzel, let down your..." Let the toucan represent the other topoisomerase inhibiting drugs, topotecan and irinotecan. Specifically, these agents inhibit topoisomerase 1, hence the single-stranded, timelessly fashionable ponytail flaunted by the prince. Unlike topoisomerase 2, topoisomerase 1 only makes single-stranded nicks to relieve negative supercoiling. However, just like with the other topoisomerase blocking agents, inhibiting topoisomerase 1 causes DNA damage and arrests cells in the S phase or G2 phase. Topotecan is indicated in ovarian cancer and small cell lung cancers, while irinotecan is an effective therapy for colon cancer. The two most common side effects seen with topoisomerase 1 inhibitors are myelosuppression and diarrhea, so remember that spilling bone-shaped suitcase at the bottom of the tower. And to remind you of diarrhea specifically, let's sketch in some loose bird stool plopping onto the Prince's toucan gauntlet. Most chemotherapeutic agents are associated with acute GI toxicity such as nausea, vomiting, and diarrhea. Certain agents, however, such as irinotecan and 5-FU, cause major cytotoxic damage to all those rapidly dividing cells of the intestinal mucosa, leading to loss of epithelium. A late-onset diarrhea that occurs 2 to 10 days after treatment can be particularly severe, leading to major electrolyte imbalances and dehydration. Alright, I hate to cut the story off right at the height of the action. Cut? Height? Huh? I'm so alone. But it's time to head over to another classic scene from literature where we'll encounter yet another damsel in distress, embodying our next set of antineoplastic agents, the microtubule inhibitors.